This video will show you how to properly administer your VialMate medication by gravity. Please follow all instructions shown in this video. Administering your VialMate medication by gravity at home can be safe and easy with proper instruction. Your home health nurse will be available to instruct you on the procedure following discharge and will visit weekly and as needed for your catheter dressing change and any labs that your doctor has ordered. Please begin by preparing your work surface by cleaning the area thoroughly with soap and water or a disinfectant wipe, and drying thoroughly as well. Wash your hands thoroughly for at least 20 seconds. And dry as well. Use a separate towel to turn the faucet off. Gather your flushing supplies, the gravity tubing with inline filter, the IV pole, medication bag with vial attached, and any other supplies as directed. Prepare both pre-filled syringes of sodium chloride, also known as normal saline, and heparin if necessary by holding the syringe with the tip in an upright position. Gently pull back on the plunger, then push gently forward on the plunger to expel any air that is in the syringe. Do not touch the tip of the sterile syringe. Repeat this procedure with each syringe. Inspect the bag of medication for any leaks, particulate matter, and clarity of medication. Check the label on the medication bag for the correct patient name, drug, and frequency. Prepare the bag of VialMate medication as directed by your home health care nurse. Squeeze the bag and check the vial for any system leaks. To mix the medication, hold the white vial gripper firmly in one hand and the blue port adapter in the other hand. Twist slightly to line up the ribs of the blue port adapter and white vial gripper. Push the blue port adapter into the white gripper. Hold the bag above the vial and gently squeeze the solution until the vial is about half full. Fold the vial up to rest against the IV solution bag. While holding the vial and bag together, shake to mix the drug into the solution. Hold the bag below the vial. Gently squeeze the bag to force air to bubble up into the vial. Release the IV solution bag to drain the solution from the vial. Repeat until the vial is empty. Do not remove the drug vial from the bag. Remove the tubing with filter from the package and close the roller clamp. Remove the protective tab from the entry point on the medication bag. Remove the cover from the spike on the gravity tubing and insert the spike into the medication bag using a pushing, twisting motion. Do not touch the spike. Hang the medication bag on the IV pole. Squeeze the drip chamber, filling it half full. Prime the entire length of the tubing with medication by slowly opening the roller clamp and inverting the filter until the tubing fills completely with fluid. When a droplet of medication is noted at the end of the tubing, close the roller clamp. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with a prescribed amount of sodium chloride as directed by your nurse using a push-pause method. Disconnect the syringe. SASH method. S stands for sodium chloride. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Remove the end cap from the gravity tubing and attach it to the injection cap of your IV catheter by pushing and turning clockwise to secure in place. Do not touch the tip of the tubing. To calculate the flow rate, slightly open the roller clamp and count the number of drops for 1 minute. SASH method. A stands for administer medication. Monitor your infusion progress by observing appropriate number of drops in the drip chamber. Monitor the flow rate frequently. When the medication bag is empty and drops of medication are no longer seen in the drip chamber, the infusion is complete. Close the roller clamp. Disconnect the bag from the injection cap of your IV catheter. If another dose of medication is to be administered the same day, place a light blue sterile cap on the end of the bag using sterile technique. Gravity bag is to be changed daily. You will reuse the bag when administering more than 1 infusion per day. If bag is not to be reused, discard into an appropriate container. Scrub the hub of your injection cap vigorously for 30 seconds with an antiseptic wipe. And allow to dry for 60 seconds. Attach the pre-filled syringe of sodium chloride to the end of your injection cap by pushing and turning clockwise to secure the syringe in place. Flush the catheter with the prescribed amount of sodium chloride as directed by your nurse using a push-pause method. SASH method. S stands for sodium chloride. Disconnect the syringe. If your catheter requires the use of heparin, scrub the hub of your injection cap again with a new antiseptic wipe for 30 seconds. And allow to dry for 60 seconds. Attach the pre-filled heparin syringe to your injection cap and flush the IV catheter with contents. SASH method. H stands for heparin. Disconnect the heparin syringe. All supplies and syringes can be double bagged and disposed of with your household garbage. Make sure to wash your hands thoroughly. Properly administering your VialMate medication by gravity at home is important to your safety. In the event of an emergency, always call 911.